So first of all, thank you so much. Good morning, everybody. Thank you for registering this webinar um, and joining this call. So thank you so much. And let me have a quick round of introduction. We have a couple of people who will be the moderators for this webinar today. Myself, Lakshmi Narayana. I'm the Vice President at Plutus Health, managing the RCM operations. And I also have my colleague, Phan, who is a Senior Client Success Manager at Plutus Health, who works in the US. So this is our panel today, and we would love to get things started. Let me start with a simple question about today's agenda that we have. How many of us were taught that eligibility verification means answering just one question? Is the patient active on the date of service? Right? So that is what we were always taught, maybe 20, 25 years back. But for a long time, that was enough. But in 2026, for sure, this mindset is costing all the healthcare organizations the real money in the form of denials. And then the denials has to be reworked. And then there are, money lost on the table. And eventually, your patient self-pay AR grows, and that leads to multiple statements being sent out. That's an additional cost that comes, to the practice. And then eventually, when patient doesn't respond, you have to move it to the collection agency and show it up as a bad debts write-off. So, from eligibility and the benefit standpoint, for all the CFOs and CEOs at all the healthcare practices, eligibility, variability is no longer an operational nuances. It's a balance sheet risk. So that's how we look at it as an insurance verification process today. So today, I want to, before we get started, I want to quickly run through the presentation. So here is the agenda for our discussion. I think I just completed my introduction about myself and my colleague who is part of this call. And then the second topic that we want to talk about is the challenges faced by the healthcare facilities or the organizations today. And then what are the impacts of not completing the insurance eligibility and benefit verifications ahead of time? And then talk about why insurance verification is so important. The fifth one that we want to cover as part of our webinar is the 2026 eligibility landscape. What are the pros and cons? And then the eligibility verification framework, how does health looks at eligibility and create framework for our, for all the clients. And then the last one we want to talk about is the case study. When I say case study, we have, what we have done with our existing clients. We wanted to quickly run through, we call it as a precision meets excellence. Before we get started, I just want to, request every participants on this webinar. If you have any, questions, do drop it in the questionnaires, box. We want to keep the last 10 to 15 minutes to go over those questions and see how we could, respond to all those questions. All right. So let me begin with the challenges faced by the current healthcare facilities or the healthcare the healthcare clinics today. And the way I envision this eligibility insurance today is most RCM team chase the denials in AR like a firefighters. Most RCM teams don't realize that the proper eligibility verifications, the RCM teams chase denials like an AR fighter. So why do I say firefighters? Because most the front-end team does not realize that eligibility is is very, very important in the entire revenue cycle spectrum of services. So we always rush from one flare up to the next, either by reworking those denials, or we eventually have to send appeals because the claims were not getting paid because the verification was not done upfront. And then you have to do a multiple follow-ups And that's how the most of the healthcare practices start losing the money. While the firefighting is a heroic, but it comes at a very, very expensive cost. It also exhausting, and it can be preventable had we put a right process in place. So the goal isn't to fight fire faster here. It is to reduce the number of denials that we come in. So the next point that I want to talk about, when with most of the whether it's a new beginners or the new startups of the healthcare facilities, or the existing the healthcare facilities, or the clinics, or the large health systems. So what is currently today missing is the very clear defined process. Many many healthcare facilities don't realize what happens if the the already scheduled appointments where the eligibility is not verified, and then the last minute stat appointments that comes up on the and that shows up on the appointments. So these stat appointments are very, very time sensitive, and it often gets booked very quickly and moved up or inserted into the schedules at the last minute, leaving very little time for the traditional pre-visit checks. So in the whole process, what happens is there is no eligibility, verification is not being completed. The benefit clarity is missing. When I say benefit clarity, what is the co-pays, what is the deductible, what is the co-insurance if patient does not have the cost sharing in the form of secondary insurance. And then it eventually boils down to other issues like the authorization wherever it is required. The pre-cert triage has not been completed. And the last and very, very important point is the patient financial communication. So these are some of the risks, especially when we have the last minute stat appointments being considered. Uh, and then what happens as a result of it, the appointment is either delayed, rescheduled, and then you are not able to have enough time to kind of converse with the patients to convert that visit into self-pay because you don't have the active insurance. And eventually it comes back as a denial. And each scenarios which I just talked about would come at a very, very expensive cost. Um, this is where having scheduled appointments verification, insurance verification becomes extremely important. The next scenario that I want to talk about is the money lost or the delayed even before the claims are submitted. So a minute back I talked about why it is so important. This is where most health practices lose money because uh, one, they're not even verified eligibility. Two, whether the self-pay patient, wherever there's an insurance inactivity is there, so that those patients are not being notified and had a conversation, and eventually those claims gets billed out and then comes back in the form of denials. So eligibility and insurance verification is not an administrative step anymore, and it's more of a financial control point. So when the front end is very, very weak, the back end becomes an expensive cleanup operations. So this is where I think most practices tend to miss out on the opportunities, and then push the front desk to do every single activity, like right from scheduling an appointment and then verifying the eligibility when the patient walks in at the door. And there is no time to have these financial discussions with the patients, and eventually patient walks out of the door without making any payments. That leads to the lost money. um, and the next one, which is very, very important, is the very less patient engagement. So what it means that if the patients are notified in advance about uh, what is their insurance plans looks like, are they eligible for the upcoming visit, has the benefits being verified, what is the co-insurance, co-pay, deductible has all been captured, and then it is given to the financial counselors and have the conversation with the patients and inform that patient owes certain money at the time of the visit. So that way, patient will not be dissatisfied last minute asking them to make certain payments, and then you will eventually retain those patients coming back to their clinic again. So And then what happens is, very low engagement. When I say low engagement, when all these scenarios does not happen at the practice, so it eventually leads to dissatisfaction, incomplete or outdated insurance data at the time of intake or at the time of scheduling. And then if there are any other cost sharing, like secondary insurance, secondary insurance is not being, received from the patients. Then there is a coordination of benefits not being verified, who is primary versus who is secondary. All these kind of adds up towards, at the billing. So this kind of adds up additional resources to be added to make sure that all these cleanup happens. Um, then these gaps don't appear as engagement issues on reports, but these appears as the eligibility related denials, and then preventable write-offs, and then a delayed AR and rework across different teams. Like billing had to rework those, or if it is come back as a denial, AR had to rework all those scenarios. The next one is the out-of-pocket expenses, again, which is again goes back to the my previous point that we discussed about having the patient counselors reach out to the patients well ahead of the appointments. And why it matters is, one of the most common and preventable breakdowns in our revenue cycle management is not to notify the patients on their true out-of-pocket expenses responsibility even before the service begins. So this is not just a billing issue. This is more of the front end issue which need to be communicated well in advance. It directly impacts the patient trust. It impacts the collections. It impacts on the denial rates, and everything gets accumulated over a period of time. So that is one of the reason why out of pocket expenses notification is so important for the patients. And then the last one, as part of the challenges that most of the current healthcare facilities faces, is the front end is, if the front end is loose, the back end is just an expensive. So the more and more breakdown in the process at the front end, eventually somebody at the back end, like the denial teams or the account receivables team, had to pick up those accounts, rework all those, and most of the time these reworks eventually leads to moving the balance to the patients. And once the patient balance move to the balances are moved to the patient, eventually 70% of the time, or 60 to 70% of the time, those monies are lost and lead to the bad debts write-off. So insurance not verifying is one very big factor which leads to the drop in collections. uh, Coverage active, benefits verification, and then most importantly, the carve outs in the ever changing insurance landscape. There are so many additional factors that comes in, like the carve outs, the plan changes. So nobody realizes that these are extremely important at the time of insurance verification, to make sure that every base is covered, and then the notification is given to the patients well in advance. And then the other important factor is the out of network or ineligible plans. So very often what happens is people just check the box in order to get patients verified. What they don't realize is there are scenarios like patient is coming out of their network and meeting the physicians. And then what happens if the patient is out of network? And there are scenarios where there will be ineligible plans identified after the visit. So all these scenarios can be arrested if we have the right front-end process established. Um, and then another factor, while we, having those front end is, making sure that we have the right, patient's ID card being scanned into the billing system, because that plays a very important role, especially when the claim gets billed out. Not having the right group plans, not having the right payer IDs would eventually lead to the delayed reimbursement as well. So that's another important factor that I wanted to stress as part of this session. Practice should one key call out I would definitely want to highlight is practice should stop treating insurance verification as just a checkbox. What I mentioned, treat it as a financial gatekeeper, because that's extremely important, and invest effort wherever it takes, or where it creates leverage the front end, because once the front end fails, every dollar recovered later costs more time, more efforts, and then that comes with more money being, spent in order to collect those monies. Uh, and the last one is the that this is our based on our observations and the historical facts is 80% of the revenue lost when patient steps out of the clinic. So what it means is when patients is not notified about their insurance verification process, out of pocket expenses, cost sharing, high deductible plans is patient leaves the office after getting the treatment, then it's only about 20% of the patients makes the payment when they get the statement. The remaining 80% of this, patients would not even respond back to the practice, and that leads to the delayed reimbursements, and then that leads to eventually, moving them to the collection agencies and moving them into the bad debts write-off. So that is one of the biggest pain points that we have observed as part of the challenges that most healthcare facilities today have. That covers my first talking point. I would move on the this topic of the impact. What is the impact of missed insurance verification to my colleague Mark Phan? Mark?
Thanks, Lakshmi. So a lot of these points you're seeing here on the screen was kind of generally touched by Lakshmi, but I wanted to kind of go a little bit deeper and provide some specifics. So when we were talking about missed office revenue, the easiest way would be kind of given a scenario or an example. So let's say that your facility does like 2,000 visits a month, and let's give an average of about $250 per visit is what you typically would get. Now, what we're seeing in the industry right now is roughly about 10% is going to be related to this eligibility or verification error or miss, right? So if you calculate that's roughly about 200 claims a month. So if you're doing 200 visits a month times $250, it's about $50,000 a month. Now, this is out of that 10%, you're looking at roughly 50,000 in denied claims. So if you expand that out to a year, that's $600,000. Now, what we're seeing in this industry is roughly 65% right off the bat is going to be uncollectible or at least lost, right? Because you were not able to do the said steps that Lakshmi mentioned and the insurance verification. Now, the remaining 35%, you do have the option of trying to rework them, right? You're working through your aging, but that is also an additional cost, right? Because you're now using additional time and staff to go ahead and reprocess the claims and getting it a second time. And it still doesn't guarantee that you'll get these paid. So, um, all of that money is first not paid by the insurance. And so now this is going to end up going into the second point, which is your patient responsibility or patient AR, right? If the insurance allows it, you will now have to move this to patient responsibility. This, in addition to some other factors that are increasing your patient responsibility. The plans now have a higher deductible. They have a higher copay. They have higher co-insurance. They may not have a secondary insurance to help with these. So these factors impact an additional growth to what you're already adding now by missing the verification in the front end and causing this to be pushed back to the patients, right? Um, Now, the patients don't always help you as well, right? Sometimes they don't inform you that maybe they got a new job, the new insurance changed, right? Or that they had a gap. We call it a coverage gap. Maybe they forgot to pay a premium 1 month and they didn't notify the facility, right? There could be other scenarios where they end up getting a new job, but they don't tell you that they have a new insurance. So coordination benefits are not caught. And this is also leading to additional denial and potential timely filing by the time you figure this out. So all these factors will significantly increase your patient responsibility. Now, what you'll typically see as well is to attack really either old or be aggressive in terms of collecting patient responsibility is using or leveraging collection agencies, right? The problem with using collection agency is that's an additional expense and they're not cheap. right? Mostly what we're seeing on average is they will charge you an additional 20 to 40% on whatever they collect. And they don't guarantee that they will collect anything, right? Um, so with all those factors, this is going to end up leading to patient dissatisfaction, right? You're now going after me, telling me that my insurance isn't covering whatever services I have. You're sending me to collections. This can affect my credit, right? All of these things give me a negative connotation of my services rendered and experience at your facility, makes me less likely to come back, right? So not only do you lose your outstanding patient, but now you have less likelihood of collecting that money. All of these factors here um, play into the fact that we now see that patient responsibility is the fastest growing and hardest to collect to date. So with all of these factors, this is eventually going to lead to complete revenue loss, right? Because if you can't collect, eventually you're going to have to go to that last point on the screen, which is bad debt write-off, and that's a complete wash. So, uh, when the next slide comes out, this is why it's so important to do insurance verification in the beginning. And Lakshmi will go ahead and speak on the points if you go to the next slide.
Right. Thank you so much, Mark. So as we talked about, the challenges some of the healthcare facilities that today that they are going through, with so many payer policy changes, and then patients quitting the job from one employer to another employer, and then certain patients are having higher deductible plans, and all these kind of becomes extremely important in a healthy revenue cycle world. Right. So this is where we wanted to clearly call out why insurance verification is so important and so critical in our businesses today. So one, establishing the patient insurance is active is great, and then while we do that, we also are supposed to look for any carve outs. Are there any carve outs that needs to be highlighted, and look at what are their out of pocket expenses, and then verify what is their outstanding deductible. And every healthcare facility has a different ways and means of managing their business. Some will try and collect a certain amount of money upfront at the time of visit. Some of them will follow a traditional method of, billing the claims to the insurance and come back as a denial. And then you take a regular, approach of sending the statements out and then making the follow-ups and try and collect. So there are different ways of looking at this. So insurance, coverage can change frequently. That is one of the reasons why insurance verification is extremely important, because beginning of the month you must have checked eligibility, but by end of the month, patient might switch from one plan to another plan. Right. So this is where having a regular insurance verification is extremely important, because patients can frequently change the job, they might change the plan, or maybe they would have missed the premium payments towards insurance. So all these would have an impact if the patients are not insurance is not verified for every single visit. So in most healthcare facilities, what happens, they do these eligibility checks when patients are new, but when the patients are established, what they forget is that they are supposed to check eligibility whenever the patient comes back, because there is always a risk of patient moving out of that plan, switching from the traditional plans into the managed care plans, or they're changing completely from one insurance to another insurance, while they might have an act, beginning of the year, they might purchase the insurance, in policy, but during the course of the year, they would have not paid the premium, and that coverage stops in between. So there are various reasons why it is extremely important for healthcare facilities to make sure that every single time the patient appointment comes up, verification needs to be completed. So verifying active coverage is not only ensures the provider is billing to the correct insurance for the date of service, but it also confirms effective date and the termination date of the policy, subscriber versus dependent status, because that's another area where nowadays insurance is extremely critical, they watch out for every information that is coming on the claim form is extremely accurate. And then establish the right insurance plan. Is it a traditional plan versus the MCOs or the EPOs, or what is the patient plan is active with, and then emphasize that if the coverage is inactive, immediately highlight and flag it to the patient counselors to reach out to the patients ahead of the visit rather than billing it out and getting the claims denied. And then, active insurance verification not only, supports smoother patient financial conversation, but it reduces too much of reworks from happening. This is where today, and as I mentioned right from the beginning, Mark and myself, we are trying to cover, 20% of the work today gets reworked because, something was not done right at the first place. And then there's another point that we mentioned about the carve-outs. Why carve-outs is very important, because carve-outs, especially, there are certain specialties which is very, very important for us to know what is carve-outs, what it refers to specific services that are excluded from the main health plan. I just want to give a quick examples like some common carve-outs that we generally come across is the behavioral health and the mental health services. Not necessarily every patient policy have those benefits built in. And then if there is a specialty pharmacy, if somebody is opting, let's say if they're coming for an oncology services or the infusion services, so the drugs comes with extremely heavy price. So is that a specialty pharmacy is a carve out, or is it included? Is the labs, the radiologies, or the imaging services are covered, or the DME supplies are covered. So these are all extremely important for the practice to understand, why insurance verification is so important. And as we emphasizing that, giving a heads up to the patients ahead of patient visits and making sure that, collect at least certain amount of money at the time of visit, reduces the financial risk rather than doing post follow-up, post insurance adjudication follow-ups, which reduces the significant amount of revenue leakages to the practices. Next, I'm moving on to the next slide, which is extremely important, which is called as 2026 the eligibility landscape. And this is extremely important. As I mentioned, historically we were taught, we just have to verify whether the patient is eligible, and if eligible, that ends the verification process. But now the things is changing dramatically, with payer, becoming very strict over a period of time. And, especially going into this year, there are a lot more, payers are, having a lot more, scrutiny, then making sure that every single claim is thoroughly validated. So now the payers are under intense cost control pressure. While we are trying to collect as much as possible from the insurance companies do have a lot of pressure from them to control the cost from their end. So that is leading to a tighter front-end activities. So when I say tighten activities, they are trying to make sure that every single claims, they are putting a logics to make sure that they verify every single information that is coming is accurate. So, insurance verification is no more a routine administrative step. It's more of a risk control checkpoint. So, what we need to do is uh, before I go there, what used to be a good enough verification is no longer sufficient, heads up. So all these small gaps in eligibility and benefit verification now eventually, result in a denials, delayed payments, lost payments. And then when we, try to reach patients gets very much dissatisfied. They try to switch from this current provider into another practice who could treat them better. So all these things are extremely important. And then when I say increasing payer scrutiny, what has changed in 2026? So now what has happened is payers are now validating more data elements upfront rather than doing an audit a year later and trying to recoup or doing the offset to get their money back. So, when I say upfront, verification by insurance companies, so they're making sure that they're checking all the coverage effective dates. No claims will be paid if the eligibility is inactive. And then they're also making sure that the plan type, the network, is it being built in network, out of network, benefit limitations and exclusions. That's another point that is being verified by the insurance very carefully. And then another very important point is authorization dependencies. So all these additional checkpoints have been put in place, and they have automated most of these in the form of edits rather than doing it manually. So nowadays, up until now, the real-time adjudication means errors and are detected faster than the denial sooner. So earlier, what used to happen is the real-time eligibility is something that most of the healthcare facilities were very, very dependent upon. But even now, real-time eligibility does not give most of the information like the carve-outs. Is there any specific exclusions, policy exclusions, whether certain services are covered? So most of this information, even the real-time eligibility, does not help us. Especially for the healthcare physicians or the healthcare practices. And then eligibility, is now becoming a growing complexity. That's another extremely important because of these high deductible plans. This was introduced in the last few years, where patient is now becoming more like an insurance, where they have to pay higher amount of deductibles even before the insurance starts making the payments. So identifying whether the patient is under the high deductible plan is extremely important, and then making sure that those information is spoken with the patients and give a heads up about what is expected when they visit the practice, and then the frequent plan changes during the year. That's another complexity that we are coming across, especially when it comes to eligibility verification. Employer sponsored plans with the custom benefit designs. When I say custom benefit designs, not every services that are available in the market is included with the employer sponsored plans. That's another area where insurance eligibility becomes so important, to make sure that all those carve outs are identified and notified to the practice well ahead. And then Medicaid eligibility fluctuations and retroactive terminations, right? So, the moment patient gets into a Medicaid plan, it doesn't mean that patient is active forever. Depending on their financial status, Medicaid eligibility could go up and down. They might be moved out of Medicaid, and they have to take the MCOs in order to get, to keep the, healthcare, care being given to the patients. So all these are extremely important. That is, these are some of the missing links that I would definitely want to call out, and that's one of the reasons why on the screen you see that increasing payer scrutiny and the missing links. So the missing links are typically the active coverage, the network tiers, making sure that they are in network, patient is in network, out of network. Um, Whether the patients who are coming in for the service, is it covered as part of the services, and then whether the patient policy or the plans requires any referral or authorization triggers, and then lack of documentation, and then inconsistent interpretation of payer responses, especially nowadays when a person calls an insurance, they don't cover all these questions. So this is where half of the information gets lost or not gathered when they're on a call with insurance, with insurance representatives. So payer scrutiny is definitely going to continue, and it is only going to increase, and it is not going to come down. So this is where insurance verification is now the norm, and traditional verification model is not going to help any healthcare facilities unless they make the shift. So just to close the missing link, point that I talked about, revenue compliance and patient relationships are extremely important in eligibility verification process. The next one is on the impact on the plan changes, the coverages. As I mentioned, this is extremely important because In our earlier slides, we talked about how insurance verification plays a very, very important role because it's no more an administrative job. It's more like a financial control. So even a small inaccuracies in eligibility benefits, it kind of leads to the claim denials, underpayments, and then payment delays, increased rework, and that comes at a cost. And then these coverage gaps doesn't not only just doesn't create denials, they convert expected insurance revenue drop, and that would eventually leads into a bad debts write-off. So the downstream effects of on the revenue cycle, also shows up on the revenue cycle performance. Your increase in the denial rates, your longer AR days that shows up on your books, higher cost to collect because you're already spending so much money on the front end verification and the the billing activities, and then you have another team who has to again rework the whole process because the first step it was missing, and then that comes with the higher cost to collect, and then there is a staff burnout due to the reworks, and then reduced predictability because you're not able to predict the cash flow because the insurance verification is not being effective enough to really predict what is expected each month in the form of the reimbursement from the insurance companies. And then the next point is, why basic eligibility are no more or no longer enough in 2025. I would rather call it as a myth versus the reality. So, for years, eligibility, verification meant answering a simple question: is patient active? But, as the insurance landscape is changing, pretty much every year, this approach is no more sufficient, and in many cases, financially not at all viable. These rising patient responsibility, payer policies, and the automations and post-service audits mean that eligibility is no longer a binary. It's more of a multidimensional. So today we will, have to break it down by a common myth versus operational reality. So I want to give some examples of what is the different myths that I'm referring to. So if the patient is eligible, we assume that the claim will pay. So that's the first myth. The second myth is, the real-time eligibility gives everything that the practice needs, which is another myth. The third one is deductible and copay info is accurate and reliable, which is not necessarily true all the time because it changes every visit because patients not necessarily come to the same healthcare facilities. They go to multiple healthcare facilities. The deductibles could vary from each visit to visit. And then the fourth myth is the prior authorization is a separate issue, which we can cover it on the next webinar. But that's another myth. People think that, okay, just because I submitted a prior authorization and got certain approvals, money is guaranteed. That's not necessarily true. Myth number 5, which is very important, is the network status. What practices don't realize is the in-network versus the out-of-network differences. And then in the whole mix of patient walking in at the front desk, the front desk team will not have enough time to look at the network status, whether they are in network, whether they are out of network, even if they are look at the different plans, whether they need a referral from the referring physicians. All these things are missed at the time of visit. So these are some of the myths that I wanted to call out, which is very, very common across the healthcare facilities. Um, you know, and then from moving from myth to the realities, basic, as I mentioned, basic eligibility checks are, not going to help anywhere, or that's not going to help any healthcare facility. So in today's world, it's all about, seeing the full financial picture before care is being delivered. So this is where, some of the back office companies would help the healthcare facilities to make sure these are addressed and given enough heads up to the healthcare facility so that their front desk spends enough time with the patients, explaining the scenarios, explain everything even before the patient walks into the clinic. So in 2026, most successful healthcare organizations move from just a mere eligibility confirmation to a coverage intelligence. I would rather don't call it as a coverage confirmation, but it's more of a coverage intelligence. So you do all your due diligence, making sure right from establishing the verification, establishing the out-of-pockets, the secondary insurance, gathering all the required correct information from the patients, establishing the plan types, making sure that they are in network, out of network, if there's a referral required. So all these, I would rather call it as a coverage intelligence rather than just looking, you're ticking the boxes, eligibility verified. So the goal is not no longer just avoiding denials. It's all about predictability, transparency, and trust with patients. And then the last one is the financial resilience. So this is a quick up, I wanted to call out about the myth versus the reality here. Moving on to the next, which is the eligibility framework that we have created here for the discussion today, and my colleague Mark is going to take over this. Mark.
Thanks, Lakshmi. So, if you recall, when I was talking earlier on a couple of slides prior, it was the impact of the miss or fail of verifying insurance. So, this slide, we're going to show you how we do it here at Plutus to go ahead and mitigate a lot of those gaps and pitfalls. So, if you see here, we implement and utilize a methodology of verifying the appointment at least 20 days in advance, right? Whether large or small clientele. Now, the reason why we do that is it allows us to check eligibility in as early as possible to avoid any, surprises, right? Another is to actually improve predictability, right? We will know how much it'll be, what is the patient responsibility, what is our responsibility. This also then will tie into better patient experience, right? When they are informed ahead of time, they know exactly what they owe: $10 copay, $20 coinsurance, et cetera, et cetera. This will also increase the patient experience, right? This will also then now allow us to align for any requirements or requests, and I'm talking about referrals and or authorizations. Typically, in the across the board, it takes around anywhere to 7 to 14 business days to occur one, right? So, doing this 21 days in advance allows us the time to go ahead and do that, as well as inform the patient ahead of time if it's something that we need from their end, right? Now, in terms of finance, this will also have impact, meaning now that we know all this information, it should lower our denial rates, right? We know that if there's active coverage, we should not get a denial for inactive coverage. We should also know if the services are covered, if an authorization or referral is required. We have all that information. It'll show lower our denials. In tandem, this will also increase our clean claim rate, right? Now that we know if this is going to go through the first time around, we should be able to submit the claim confidently and expect within the usual and customary processing time of that said payer, they'll go ahead and process and pay the first time around. This will then lead to faster cash flow. And again, this will reduce not only the denials, but then potential patient responsibility to the patients and or just eventually bad debt write-off, right? So what we leverage here at Plutus will also then go into what we call the patient financial counseling workflow, right? Now, this implementation can be leveraged to your front staff or your front office, where this is where once they get that information, they should be reaching out to those families 21 days in advance and letting them know this is what your benefits are, this is what you are covered for, this is what isn't covered for, this is what needs a referral, et cetera, et cetera. From the patient experience, knowing that I owe $10 when I get in, that I need a referral to get this procedure done, how long will it take, right? This will be a lot more comforting than I show up, I don't know what I'm owing, I go in there and all I know, maybe these things aren't covered, I have to pay out of pocket type of scenario, right? But if I know ahead of time, this will give me a chance to not only prepare mentally, but also financially if there's an exorbitant amount of cost. All of this will tie into your patient experience, which will then in turn increase your patient engagement and longevity, right? The more that they're happy, the more they're likely to stay on. right? So those are the best practices that we've implemented at Plutus for our accounts and clients, and we are seeing significant improvements in both patient experience as well as cash flow. And as Lakshmi mentioned on the next slide, we actually have two case studies that we want to bring up that where we personally have done this for our accounts and has provided results. So, Lakshmi, okay. So, I'll speak on the first one. So the first one, case study that we have a very large client that operates across 36 states. Now, on a monthly average, they see roughly 150,000 visits. When we took them on, we saw a significant denial percentage related to insurance verification. This ended up attributing to roughly 30% of their patient AR was solely for those reasons, right? So when we came on and we implemented that process we showed on the previous slide, within the first 30 days, we ended up creating a dedicated eligibility team from our end. In addition to support with automation and some tech, we were able to reduce their denials and inactive coverage categories by roughly 60%. And not only that is because of the volume and because we did some tweaking with the clients as well, we ended up pushing that 21 days out to make it 30 days out. And again, it's a preference depending on your clinic or your facility, right? But 21 is our general baseline start. Because of that, within those 60 days, we saw the front end reduction go from 30% to around 1%. Because of that, we ended up collecting $2 million from the insurance in 90 days versus getting a lot of that balance getting pushed to patient responsibility. So what I'll say is to the audience,
Mhm.
go ahead and review, but both case studies
Yeah.
emphasize the same point that we were mentioning, where establishing a solid insurance verification process in place will not only mitigate increase in patient AR and patient experience, but also increase your cash flow in a timely manner. Can you go to the last slide, Lakshmi?
I just want to call out. We'll give another, we still have about 7 minutes. So if anybody has any questions, I think we'll be more than happy to take those questions and make the best use of those 7 minutes. And, if you don't have any questions right now, and if you have any questions that you need to follow up, and I think we have given the email ID called, support@plutushealthinc.com. We'll be more than happy to answer any questions that you have related to insurance eligibility verification process or any other processes that are related to revenue cycle management.
Yeah, so with the remaining 5 minutes, Lakshmi, let me find a question or two for you to answer while we can still have this time. So here is one. So in your experience, where do most healthcare organizations underestimate revenue leakage in the eligibility and insurance verification process? Um, yeah, let's start with that one.
Okay, so I think most healthcare organizations have I would say they take a two different approach. And as I mentioned, what they don't realize is people most of the healthcare facilities think that the denials occur from the coding and then the incorrect submissions. What they don't realize is at least a good 20-25% of those gets established because the proper insurance verification was not done. So when I say proper insurance verification, we touched upon it. How it's not just about ticking the box in order the patient is eligible, whether the patient's the services is covered under the plan. Do they have any carve outs? Is it a traditional plan versus the MCOs? If they have MCOs, 9 out of 10 times patients forget to give the MCO plans. And then at the time of visit, patient switches from their traditional plans into the managed care organizations. And then that takes an additional 30 to 60 days for us to identify those, rework on it, and then get it. So in my opinion, while the front-end process is the major bottleneck for most of the healthcare facilities or the healthcare practices, because they always think that the denials would come in only because post the claim submission happens in the form of the coding and the medical record requests and so on and so forth. But ideally, at least about 20% of it actually originates from the front end process.
All right. I think we have time for one more, and I think I got a good one for you, Lakshmi. So, what
Mhm.
measurable KPI should leadership monitor to prevent these losses?
Great. I mean, ideally, for the best practices of in any healthcare practice are the if you have to look at the health of the practice, your KPI metrics are extremely important. I think one of the very important metrics is the denials. And again, is the denials out of control or is it denials under control? Or are there any other metrics that you want to look at, like besides denials, what's your net collection rate? What's your gross collection rates? But all those would get tied up to the denials. Is your health of the practice is dependent on how clean the claim is going out and claims are getting paid at the very first instance. So I would say the denials, anything less than 4%, any client is doing keeping the denials less than 4% are doing fantastic. Anybody is beyond 5% to 10% is a red flag. Anybody beyond 10% is extremely in a very bad state of affairs.
Yeah, I would completely agree. I would also include a little bit of rejections as well because they go hand in hand. But yeah, your denials for sure. All right. So as Lakshmi mentioned, again, I know his audio is better now. For any remaining questions, because I know we're right at time, if you have any additional ones, please go ahead and submit them to the email listed right here, support@plutushealthinc.com, and we'll go ahead and respond to you as quickly as possible. I believe that the recording will also be posted sometime later today, hopefully, and you can also view this for anybody else who has missed this webinar. But I think that's it for today. So again, for my colleague Lashmi and myself, Mark, we appreciate your time, everybody. And if you have any questions, please feel free to reach out to us on that contact information on the screen.
All
Have a
right.
good
So
day,
thank you so
everybody.
much, Mark, and yeah, for joining me today on the webinar. So appreciate your time, and thanks everybody for joining this call. And we'd love to hear if there are any additional questions and sent over to us, and we'll be more than happy to get on a call or probably respond back through an email, or we can schedule some time to discuss in detail.
Agreed. Thanks, everybody, for your time.
All right. Thank you so much. Thanks everybody, and have a good rest of your day.